once again, and welcome to the third presentation on Krok 2 2021 booklet. Krok 2 2021 booklet. So let's begin. So the question is, in the demographic structure of a region, the people aged from 0 to 14 make up about 31% of the population, that means the years. And then while 50 plus age groups makes up about 20% of the population. What population structure characterizes such demographic situation most accurately? So they're looking for whether the demographic structure is expansive, is constrictive, stationary, immigratory, or migration. So these are some of the things that you need to know. But looking at the age group, look at it from 0 to 14 years, 31%. From 50 going, we have what, 20% of the population. So what structure are you looking at for? Over here, we are looking at an expansive population. An expansive population, which shows a larger number or percentages of the population in the younger age groups. So when the years, the percentage is more towards the younger people, we see we have an expansive population group or an expansive population pyramid. Okay, so it shows a larger number or percentage of the population in the younger age groups, usually with each age group smaller in size or proportion than the one born before it. Now, if you talk about constrictive or constrictive population, we are dealing with a pyramid that has more of the people being in the old age, or more of the population moving to they are more of what, elderly people. So it is shrinking. Now, a population that is stationary, it means the growth rate is 0 and the age structure is constant. Immigration and migration talks about the people that moves out and the people that moves in into a population. Basically, that's what this is all about. So over here, since more, the 0 to 14 are, more, 31%. It's a lot. So it has what, an expansive or a growing or a progressive populations. And that is over here. Your answer is C, expansive population. We have a 13-year-old boy that is complaining of a dry cough and shortness of breath. Always, I tell people, if you have a question like this, always analyze the question. Dry cough, shortness of breath, what organ comes to your mind? For me, it's the lungs or the respiratory system. Now, the onset of the disease was 1 year ago. It was 1 year ago. He has a brief asphyxia attacks that occurred 1 to 2 times per month. The child is anxious and has expiratory dyspnea. Okay. Expiratory dyspnea. That means getting air out of the lungs is quite difficult. And what comes to your mind? Something that is blocking the outflow of air. And one of the things that comes to your mind is what? A constrictive bronchus or an obstructive bronchus. Obstructive bronchus or a blocked bronchus. And therefore, of course, asthma comes to my mind. All right, now his skin is pale. His nasolabial triangle is cyanotic. His respiratory rate is 48. That is high. Percussion produces a bandbox resonance over the lungs. Auscultation detects a weakened breathing with bilateral dry wheezing. Look at it. There is wheezing. Anytime you hear of wheezing too, again, it confirms that you could be dealing with what? An asthma. Forced expiratory volume is 80% of the normal. So we use forced expiratory volume when you want to measure the severity of the condition in asthma. All right. So what medicine should be prescribed to this boy? Again, you are thinking of what? Status asthmaticus, or this is what? An asthmatic attack. And the treatment is to give what we call a fast and a short-acting beta agonist or beta-2 agonist. And that is what? Salbutamol. salbutamol. And later you can give your hydrocort or your corticosteroids. All right. So main here is what? Your salbutamol. Salbutamol. This is a fast, short acting beta 2 agonist, which will dilate the bronchioles to allow air to move out. So a patient with rheumatism presents with a diastolic tremor of the chest wall. Now, again, anytime you think of rheumatism, you ask yourself, what other things comes to play? I've said this thing in some of our presentations or in our questions. All right. Rheumatism, first of all, that thing that comes to my mind, there could be a respiratory problem somewhere. That is one. Two, there could be a problem with the heart. And talking about the heart, you are thinking more of what? The mitral valve stenosis. Mitral valve stenosis. That's what comes to your mind. Okay. You can think of a problem relating to the kidney as well. Post-strep glomerulonephritis. These are the things that come to your mind anytime you hear the word rheumatism, or these things should play in your mind anytime you hear rheumatism. So let's continue. So a patient with rheumatism presents with a diastolic tremor of the chest wall, heart spur, heart sound 1 that is amplified at the apex diastolic member with a presystolic amplification, a mitral opening sound, and an ascent of the second heart sounds over the pulmonary artery. What heart defect was observed in this patient? Again, I've told you anytime there's what rheumatism, the heart pathology that you normally get is what? Is mitral valve stenosis. Mitral valve stenosis or mitral valve stenosis. Mitral valve stenosis. And over here, the correct answer here should definitely be what? Stenosis of the left atrioventricular orifice. The atrioventricular orifice means the left side, that is what? The mitral valve. So this also means mitral valve. The mitral valve. Atrioventricular orifice. The left atrioventricular orifice. That is what? The mitral valve. And we said the most common heart defect when it comes to rheumatism is what? Mitral valve stenosis. Another thing you can think about is infective endocarditis. Infective endocarditis. Also very common in people suffering from what? Rheumatism. So at a factory with harmful working conditions, a complex of measures was being taken to reduce the morbidity among the workers. Morbidity simply means what? A disease, right? Disease or the tendencies to get a disease, morbidity. All right. For better effect, the factory doctor was separately monitoring a group of people who fall ill frequently and for a long time. What type of morbidity requires distinguishing such a group of people? So you are studying the conditions or the harmful conditions of your workplace or your factory. All right. There's so many things that you need to take in place. For example, if you're in the hospital, for instance, you do what they call the PPEs, right? The protective clothing. You wear your gloves, you wear your nose masks. Yeah, basically some of the things we normally do when we are at the hospital. All right. Why? Because it reduces infections. Because the hospital settings, infection is very common. Good. So that is what we would do in our setting as doctors. Now, over here is a factory. But they said for a better effect, the factory doctor was also monitoring a group of people who normally fall ill. So those people, they normally fall ill for a long time. So what type of morbidity requires distinguishing such a group of people? So to distinguish such a group of people, you need to know what other conditions can also happen in the population that can go and come back immediately. Now, people with a long-term disabilities, they can't work for a very long time at the workplace, and your productivity at the factory will be reduced. Yes, because you don't want people who fall ill like 5 times in a year. They'll be taking sick leave, right? They will be taking sick leave every now and then, and you don't want that to be happening to your workers. All right. So The morbidity that will require for us to distinguish such a group of people is what we call morbidity with temporary what? Disability. And that is why over here, your answer is E. Morbidity with temporary disability. Because you don't want people to have long stay at the hospital or always going on leave, sick leave, going on sick leave. No, you don't want that. You don't want that. So this is going to help us to distinguish these people from such group of people. And that's over here. Your answer is E. Your answer is E. A 38-year-old patient has episode of paroxysmal hypertension. Now, when we say paroxysmal, it means sudden. Okay, sudden hypertension that reaches about 240, 120. Reaches about 240, 120. All right. And it's accompanied with nausea, vomiting, tachycardia, and excessive sweating. So, hypertension, 240, 120. That's hypertensive emergency. Hypertensive emergency. All right. Now, hyperglycemia is also observed. Look at it. There is high blood pressure. Now, hyperglycemia is also observed. Anytime there is such episode, what comes to your mind? Yes. Yes. The adrenal gland comes to your mind. The adrenal gland should come to your mind. So very, 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 very important. All right. Now, after the episode, profuse urination occurs. Renal sonography has shown a new formation adjacent to the upper pole of the right kidney. So you see, adjacent to the upper pole of the right kidney, there is a new formation over there. You see, they said it might belong to the adrenal gland. So your guess is right. The adrenal gland could be in danger. And adrenal gland, when adrenal gland hormones from the adrenal gland are produced, they can lead to what? High blood pressure and hyperglycemia. All right. But which part of the adrenal gland exactly causes this phenomenon? And over here, you are thinking of the what? The medulla. Now we have the cortex, and then we have what? The medulla. So we're talking about the medulla. So there could be a tumor of the adrenal gland or a tumor in the medulla of the adrenal gland. And that condition is called pheochromocytoma. So over here, our diagnosis is pheochromocytoma, which is a tumor of the adrenal gland tissue. And anytime there's this thing or there's such condition, it produces a lot of what? The epinephrine, the norepinephrine. And you know these things controls the heart rate and every other thing, metabolism and every other thing in the body, right? Now, to help you to confirm this, you would have to see these catecholamines. Catecholamines are the epinephrine, the norepinephrines, okay? So you have to see these catecholamines in the urine. You have to see these catecholamines in the urine, all right? And that is over here. Your answer is E. Your answer is E. All right. Now, during physical exertion, a man with a cerebral artery aneurysm, that means there is dilatation of the cerebral artery. That means the artery that supplies blood to the brain, it is dilated. And anytime something like that is, or any vessel is dilated, it has the tendency to rupture. Take note, anytime an artery is dilated, called aneurysm, it has the tendency to burst or to rupture. Now look at it. They said this man suddenly developed severe headache and vomiting and then fainted. Patient is agitated and wants to run somewhere. So things are happening in the brain. 462, asthmatic, blood pressure is not mildly elevated. 140/90 is not bad. Body temperature is just at the borderline. Now look at it. He has neutral rigidity and positive Koenig sign. And I've told you that anytime there is neutral rigidity, Koenig sign, Brzezinski signs, photophobia, phonophobia, these are signs of what? Meningism. Signs of meningism. And again, we have gone on to talk about differentials for meningism. We've talked about differentials for meningism. Differentials for meningism. So this shouldn't be what? Surprising to you. All right. Now, so we can talk about that even HPT, high blood pressure, it's a differential. You can talk about what intracranial hemorrhages as a differential. You can talk about meningitis as a differential. You can talk about encephalitis as a differential. Talk about a whole lot of things as a differential. But always look at your question, because your answer is in the history. So they said this man had a cerebral artery aneurysm. So what can possibly happen is that this artery could have what? Ruptured, meaning there is now what? A hemorrhage inside the brain. There is now what? A hemorrhage inside the brain. And that's over here the most or the possible reason why this man is suffering like this is could be because this person has ruptured the cerebral artery. And that is over here we are thinking about what? Subarachnoid hemorrhage. Subarachnoid hemorrhage. You see, I can also say it's the same as what? Brain hemorrhage, because it is the same thing as brain hemorrhage. All right. So Krok, I don't know. Because brain hemorrhage, subarachnoid hemorrhage, they are all kind of the same thing. All right. But over here, we are looking at what? Subarachnoid hemorrhage. Subarachnoid hemorrhage, due to the history of the aneurysm that is what? Present. All right. Because subarachnoid hemorrhage is a type of brain hemorrhage, as simple as that. That's why I've said if you choose brain hemorrhage, you can be correct. I mean, on real life, you are correct. But for purpose of exams, we'll go in for what? The subarachnoid hemorrhage, because that is what we are looking out for. And normally, it's very common when there is head trauma, ruptured brain aneurysms, and so on and so forth. Please, these things are very dangerous. So you have to be very, very careful. All right. And usually you see the red blood cells inside the CSF, or the cerebrospinal fluid. Okay. And this cerebrospinal fluid are found in the subarachnoid space. So maybe that's why the answer is more for subarachnoid hemorrhage. All right. We have a 14-year-old boy who developed a sympathoadrenal crisis. Sympathoadrenal crisis. Again, sympathetic innervations, that is the epinephrines, the non-epinephrines, the one that controls the flight of fight reactions. So what medicine can help us to relieve the crisis? What can help us to relieve the crisis? So definitely you are looking for a drug that has the ability to block these receptors. Okay. And these are beta-2 agonists. So these adrenal epinephrine, they act on what? Beta-2 or beta receptors, or beta agonist receptors. So you want what? A beta blockers. Basically, you want what? You would want a beta blockers, a beta blockade. And that's why you're going to go in for what to call what? Propranolol. 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 Propranolol inhibit these nervous or sympathetic nervous system by blocking the beta receptors on the nerves of the sympathetic system. So again, over here, your answer is what? Propranolol. Propranolol. So your answer is A. So in the morning, an 8-year-old child started complaining of general weakness and pain during swallowing. At noon, her parents called for a doctor because the girl's weakness was progressing and she developed a bilateral swelling slightly below and in front of her ears. So there are some seasons, or onset seasons. There's sometimes in the life of everybody that we get infected with some conditions or some viral conditions. And that's the reason why normally we do what? Vaccinations for people. Okay. One of them is what we call the mumps. Mumps. So mumps are simply viral infection that affect the salivary glands. They affect the salivary what? Glands. So something can also affect the parotid gland. All right. And you know, the anatomical location of this parotid gland and the salivary gland, it is just in front of the ears. So you can just put your hand on your ear in front of your ears. Exactly. Not at the back, in front of your ear. So you see that that place is swollen. And when you see something like that, one of the things that comes to your mind is possible what? Mumps. And of course, we can prevent this by a vaccine. So over here, you are looking at what? At A as your answer. Number, you don't treat anything, it will go by itself. All right. But of course, when there are symptoms like headache, dizziness, and things like that, you have to intervene. But apart from that, it's a viral infection. Virus, what else can you do? Nothing much. All right. So what you're looking at A as your answer, mumps. So we have a 58-year-old man, a heavy drinker, and a smoker. Okay. Drinker and a smoker. What comes to your mind? Okay. Now came to the hospital with complaints of a constant, so this is what you need to think. Constant coughing and shortness of breath. So again, the respiratory systems comes to my mind without any doubt. Lately, he has been losing weight. So again, if somebody is having coughing, shortness of breath, and now there's weight loss, it could be a chronic condition that is happening or a cancer is present. Again, a chronic condition is happening or a cancer is present. This is how you think through questions. Now, his cervical lymph nodes are enlarged and dense. The tissues above them exhibit no tension. Chest X-ray show fibrosis. Now, there's fibrosis of an upper pulmonary lobe and the left-sided pleurisy. The pleural fluid is straw-colored with the protein levels of 52 grams per liter and a high lymphocyte count. So again, something is happening. But look at it. They say malignant cells were not detected. I mean that you can easily rule out what a cancer. We can easily rule out what a cancer, but we can't rule out a chronic condition happening in this patient. Now, inoculation of the pleural fluid provided no microbial growth 1 week later. Make the right diagnosis. Gut diagnosis. Now, constant coughing is there with weight loss. Again, you are thinking of what? Chronic pathology or malignancy. All right. Now, they've told us that malignancy is not present. So definitely, I am going to be looking out for pulmonary tuberculosis. I am going to look forward for pulmonary tuberculosis. And that is what we are going in for. Pulmonary tuberculosis. And normally, findings on contaminant tuberculosis are non-specific. They are non-specific. So you need to put all of these things in your head. So it can be anything. It can be what? Anything. And again, there are some common findings you need to also know, all right, when it comes to these kind of conditions. Some of them include the presence of segmental or lobar airspace consolidation. So you can see consolidation there in pneumonia, all right. You can see ipsilateral, hilar, and mediastinal lymphadenopathy. So you see enlarged lymph nodes. And that is what we're having in this question. We're having what? Enlarged lymph nodes. Cervical lymph nodes are enlarged. And that's why I said chronic condition is happening. And in TB, you get these things a lot. So you have to always be palpating for these lymph nodes. There could be pleural effusion as well in TB. So you have to take note of that. And again, anytime they talk about protein levels in the pleural fluid, we have to call exudate and transudate. exudate and transudate. All right. Now, if the protein levels in the pleural fluid, all right, is greater than 35 grams per liter, we say we have an exudate. If it's less than that, we say we have what? A transudate. And exudate are inflammatory in origin, or infection in origin. They are infection in origin or inflammatory in origin. So please put these kind of things into perspective when you are thinking through these kind of what questions. So over here, we are definitely looking at what? For D as our answer, pulmonary tuberculosis. Pulmonary tuberculosis. A laboratory has received a milk sample for analysis. The findings are as follows. The color is whitish. Smell is normal. Taste is normal for milk. Specific gravity is 1.038. Acidity is 35. Fat is 3.2. What is the milk quality? What is the milk quality? Now, you can only tell us the quality of milk if you know what milk is, or if you can tell the composition and what it should be. Am I right? Yes. So let me take you through a little bit of learning over here. So number a regular or a whole milk has an average of 3.5% fat. Have an average of 3.5% what fat. Over here, the fat is what 3.2. So a little bit below already, isn't it? So be writing them down. It also has how do I even call it? Good. Specific gravity. Specific gravity is measured at 15 degrees or 20 degrees. It's normal, but it's supposed to be 1.023. 1.023. Over here, 1.038. 1.038. But it will be between what? 1.028. And something can go to 1.033. 1.033. The acidity of milk is usually less than the neutral point, and hence it should be less than 7.4. Acidity of milk should be less than 7.4. Less than 7.4. All right. Now, if you look at everything I've mentioned, gravity, the fat, it's just there, right? So it's not entirely very bad. All right. So we can actually drink it. So it's good. I mean, we can drink it. We can drink it. But the quality is low. The quality is definitely low. So the milk is of poor quality. The milk is of poor quality. Because it doesn't meet the exact standard of it. It doesn't meet the exact standard of it. So over here, we're looking at a poor quality of milk. So the milk is of poor quality. That's why your answer is what? Is D. All right. And this brings us to the end of this presentation. All right. So I'll see you in the next video. Stay blessed.